So today I'm going to tell you about a study that we're doing at CSU, which we've called the Transition from Nursing to Paramedicine. It's a longitudinal study, and Joe and I are going to give you the details of why we did it and what we've been studying and how things have been going. So today's presentation, we will go over the graduate diploma course, which is our nurses to paramedic transition, tell you a little bit about that. As I said, we will give you some details of our research project. We are in the midst of this research, but we will tell you about our preliminary findings, and then we'll share with you some next steps of where we're going to from here. So just to get us started, first of all, Joe's going to tell you a little bit about what we do here at CSU with respect to paramedic education and our nursing to paramedic graduate diploma.
Thanks, Tanya. At CSU, we have an undergraduate paramedic course that's delivered in Port Macquarie and Bathurst. We also have some postgrad streams. We have a grad cert in intensive care paramedic. Those are for paramedics who want to advance their skill set and to work at a different level, a higher level of care. We have a graduate certificate in paramedic service leadership and management for people getting into supervisory management and leadership roles. And our graduate diploma of clinical practice paramedicine. And this is a course where nurses can transition to paramedic practice. And I'll talk about that in a second. We're also looking at some new and exciting master's streams, research masters and course-based masters, where paramedics can learn extended care roles and critical care roles to use in practice. Now, for years, there's been double degrees where you can study a paramedic and a nursing degree together. And we offered that at CSU up until about 3 years ago. We found, though, that when people would graduate with 2 degrees, a paramedic and a nurse degree, they'd typically go into nursing. They do their nursing grad year and seldom come back to paramedic services. So we thought we'd probably better look at a different option. We also had a number of nurses who'd been doing work in pre-hospital care, things like retrieval medicine, air medicine, pediatric and neonatal transports, wanting to get a formal paramedic credential. And this is important now because paramedicine, hopefully by 2017, will be a registered health profession under APRA, and you will need a paramedic recognized certificate or a recognized degree or credential to be working as a paramedic. So we've put together a grad dip, which is 8 subjects. It could be done over a year. I don't think anybody's ever done it in a year. It's usually done over 2 years because it's 4 subjects per year. And this is a graduate diploma of clinical practice paramedic, and it's only for nurses who have an undergraduate degree and preferably have worked in acute care areas. The subjects are pharmacology, medical emergencies. There's a residential school that's done in Bathurst with the Simulation Center, a clinical placement that happens on an ambulance service in many of the services across the country, major incident management to manage triage at emergency scenes, a pediatric focus subject, particularly for trauma, resuscitation, and other pediatric emergencies, some theoretical subjects, paramedic systems, to talk about how paramedic systems are formed across Australia and indeed the world, and then paramedicine as a discipline, which looks at epistemology, philosophy, and pedagogies of paramedicine.
Thanks, Joe. So when we were looking at starting our project, the first thing we did, as any good research project does, is do a bit of a literature search. And although we weren't able to find actual literature on nurses becoming paramedics per se, there was a fair bit of literature out there around rural nursing and the need of nurses and the desire for dual credentials and the value of that, especially in rural areas. So some of the things that we found in the literature is that, as expected, nurses function as generalists in rural areas and do a very good job of that. Quite often nurses have interchangeable roles which span different professional boundaries, especially again in rural areas where there can be a deficit of workforce folks. Rural nursing offers task autonomy and variability. So I'm sure that there is a fair amount of this in the metro areas as well. But what we found in the literature is that one of the advantages of rural nursing is that nurses are able to fill a number of different roles and do a variety of work, and mostly out of necessity, as you would know, and that nurses have a tendency to enjoy that. Now, as we know, there is, especially in rural areas, a demonstrated need for emergency and resuscitation skills. And what we found in the literature for this project is that it can be very challenging to maintain these skills. We aren't necessarily exposed to these sorts of situations as often as we would like to in order to keep up our skills. And so there is a demonstrated desire to expand this skill set and to become more confident in this area. And the other thing that we found is that rural nurses will have a tendency to drift back to urban areas if they don't have autonomy and challenge and the opportunity to maintain their skills. So this was the literature foundation that we started with when we embarked on this research journey. So what is our study? What were we looking at? Well, we are doing a 3-year longitudinal study, which means that we started it back in 2012 and we're going to be finishing it up in this coming year. And we are using mixed methods, so a combination of both surveys and focus groups. We did go through the Human Ethics Committee here at CSU. We are using SPSS to analyze our survey data. So thus far, we've sent out the first student survey, which we've sent out 3 times now to 3 different cohorts. And what that survey is looking at is what is the motivation of these nursing students who are enrolled in our graduate diploma program and have the desire to become paramedics. So when they enroll in the program, what is their motivation for doing so, and what are their expectations both of the course and their ideas about becoming a paramedic? So what would be different for them? Once they graduate, the remainder of our study will involve a second survey, which will be sent out to those who are already working and who have graduated, of course, and to find out. So we asked you about your motivation and your expectations, but what has reality shown? What have you found that has been different for you now that you are a trained paramedic and working as a paramedic in many cases? And then what are your future plans with this expectation? So that's an overview of what our study is. So our survey that has gone out 3 times now has 57 questions in it, so it's quite a long survey, and of course includes all the demographics that you would need to collect. And then, although this is not an exhaustive list, this gives you an idea of what sort of questions we asked. We sought to find out what these nurses felt would be their motivation for study. And we came up with as many ideas as we could based on the literature of what we thought would be their motivations as to why they want to take paramedicine when they're already working and educated and working as a nurse. So for example, did they do it because they were looking for a change? Were they maybe burned out in their current job? As the literature suggests, were they looking for more autonomy and independence? Perhaps skill diversity or career advancement? Maybe they're just bored. Was there, as again the literature suggested, this lack of opportunity to specialize in rural areas where they were working? Maybe they were looking for less stress in their world. Maybe it was related to pay. Maybe they had some concerns about their current work culture or leadership in nursing, and they sought changes in a different workplace. Maybe it was the environment that they work in. Maybe we figured that maybe working in a hospital was not necessarily as desirable to them as the uncontrolled environment of out-of-hospital care. Or maybe they were just looking to do a different number of skills than they were doing in their current nursing. So you can see that we asked a broad range of questions, and we asked them in multiple different ways, and we really wanted to find out what was the motivation and expectations of these nurses who were training to become paramedics in our grad dip program. So as I've said, we've administered this survey 3 times, and what we're reporting on today is the results from our first 2 surveys in 2013 and 2014. At that time, we would have had 40 students that were enrolled in our graduate diploma program, and quite remarkably, we had a 100% response rate. So we were really keen to, really happy that our students were so keen to respond to that. We did run our data at this point through SPSS, and what we're going to report today are not correlations, but they're just descriptive results and frequency counts based on our SPSS findings. So just an overview of what we found so far, and recognizing that there were a couple of surveys where students missed questions here and there, so I have in my results put what the expected number of responses were. So of the 38 students who answered regarding gender, you can see that we have a 60-40 split with primarily females enrolled in this program. When it comes to age, the majority of our students identified between 25 and 34, and then the second largest group was between 18 and 24. When we asked them about their current employment when they enrolled in the program, of the 36 out of 40 that answered that question, 80% of them were working full-time in a nursing, primarily in a nursing capacity, and I'll show you that in a moment, and a small percentage of them were working part-time, casual, and we even had someone who was unemployed. As far as where they're working, you'll see that the vast majority of our students come from the emergency department, 52%, and another 21% from critical care areas like ICU or CCU. We do have a few nurses enrolled who have a background in ward nursing, and then some identified as other, and that would include mental health, pediatrics, as well as a couple from military environments. With respect to the 57 questions we asked about their motivation and expectations, we used a Likert scale and had them rate their responses on a 5-point scale from agree all the way through to strongly disagree. So this is just an overall snapshot of some of the key results we had, and I'm going to go through these in a little bit more detail. When you see the color green, that will correlate with statements that the students said that they agreed with, whereas red would be more in the direction of disagree or strongly disagree. So first of all, what we found is that 87% of the respondents, and this was all 40 students who responded to this, so 100% response rate, they agreed that the primary reason that they were enrolled in our postgraduate diploma was that they were looking for a change. Interestingly, unlike what the literature said, that wasn't due to a lack of rural opportunity to specialize. So 77% either disagreed or strongly disagreed with that statement. Again, interestingly, 73% strongly disagreed or disagreed that they were burned out in their current nursing role, and 80% disagreed or strongly disagreed that they were seeking a role that had less stress. So we can see there that the nurses who enrolled in our program were not necessarily doing so because they found their current work role was too stressful or that they were over it, but more that they were looking for a change. Again, back to the green being agree or strongly agree, this was interesting to us, is that 64% of our respondents said that they were seeking to become a paramedic related to finding more autonomy in their roles and more independence. You'll see that 75% either agreed or strongly agreed with the statement that they were becoming a paramedic because they wanted more independence with their practice. 77% definitely didn't agree that there was anything to do with pay, which is good because you wouldn't find much difference. And it was interesting when we asked them about their work culture and nursing leadership, if they felt that they would find a different culture and leadership in the paramedic environment. And the answers to that question were really balanced. And by balanced, I mean that there was a fairly well-distributed answers from agree to strongly agree to disagree to strongly disagree. So dependent upon the respondent, they had different thoughts on that, but nothing was swayed or nothing was more one than the other. We also had balanced results when we asked about whether they were doing this for career diversity or for career enhancement, and whether or not they were just bored with their current work. And again, we had, across all of the Likert scale answers, we had a balanced response. What we did find is that 75% of the respondents did agree that they were looking for a change of environment, and 72% agreed or strongly agreed in that they were looking for skill variability. So those would be key findings for us, is that they were interested in a different environment as well as to expand the variability in their skills.
So in summary, what we found, and we were quite surprised, we found that the biggest reason why nurses want to become paramedics were that they were interested in a change, moving from that in-hospital setting to the more uncontrolled, chaotic, independent practice of pre-hospital care, which leads to the autonomy. They wanted to make decisions, especially clinical and challenging decisions themselves, which is what paramedicine offers them. The environment, of course, is unique, changes every day. It's not the routine of working in a unit or a ward. Paramedicine practices in all environments, and it's completely unpredictable and exciting. At least, that's the impression anyway. And there's a great deal of independence working as a paramedic. You're typically only working with a partner. Sometimes that partner is more junior than you or at a different level of clinical practice, and therefore you're taking on a clinical leadership role and working in this independent environment, which is very exciting, we believe, from this data, which is what motivated the nurses to take this course. Now the next steps, of course, as Tanya mentioned, this is a longitudinal study. So we want to see that the impressions that these students had going into the course, or indeed through the first 2 years of the course, do actually reflect what they find in practice. So we are now going to sample the students again, now that they've been out into practice for a couple of years, working hopefully as paramedics in different services across the country, and indeed international, because we've got one student that's now working over in London. We want to see if their impressions from the beginning about independence and autonomy in a different environment are actually what they're experiencing in practice. And this will be very interesting because we can then use this as a marketing tool, or we can use this as a way to recruit more potential students into the course to demonstrate that what they believe they're going to get, they actually do get. But again, being research, we don't know if that's going to be true or not. So that's our next steps, and that's where we hope to take this research and hopefully be able to report back to all of you again in the future.
Thank you, Joe. And if you have any questions, please feel free to contact either of us on the phone number below or via our email address.